Now, we have a slight change in the programme because our next speaker, Jeffrey, has to leave early for his flight home. He was due to speak second this afternoon, but it's just been changed slightly to allow him to leave early. And when he's finished his presentation, he will take questions so that he can get away. Okay, so Dr. Jeffrey Rediger, MD, is on the faculty of Harvard Medical School. He is the medical director of McLean and Community Affairs at McLean Hospital and the chief of behavioral medicine at Caritas SE Good Samaritan Medical Center. A licensed physician and board-certified psychiatrist, he is also a Master of Divinity from Princeton Theological Seminary. His research with remarkable individuals who have recovered from illnesses considered incurable has been featured on the Oprah Winfrey and Dr. Oz shows. I didn't know that. So, among others, Dr. Rediger has been nominated for the National Bravewell Leadership Award and has received numerous awards related to leadership and patient care. A big, warm welcome for this distinguished gentleman.
Dr. Drysdale and I have spoken at a number of conferences together now. So now, if we look alike and act alike, well, you just have to figure out which one of us is which. I've got more hair. So it's really been a real pleasure to be here this weekend and to get to meet all of you and hear these fascinating questions and hear these great discussions and talk about things that we can't always feel as easily able to discuss. So, part of this whole thing is we need people who both go out and boldly plant the flag on these ways of thinking. And we also need people who try to be leaders in the sense of being a little bit ahead of the population, but not too far ahead so that you don't get things dismissed and pigeonholed. So it's a tricky balance. And at least for now, I go back and forth for years in my mind about whether it's the best thing to stay in a major institution and try to walk these lines. But for now, that's what I've chosen to do. So what I've done is back in 2002, the way I got drug into this line of research was kind of with some resistance on my part. A nurse at Mass General Hospital in Boston, an oncology nurse, was diagnosed with pancreatic cancer. She went to Brazil to a spiritist, to a healing center, and began calling me saying that she was receiving a healing for her pancreatic cancer and that I should look into this. And I said, no. I was a new young faculty member at Harvard, a new medical director, and had just gotten out of residency, and I was very doubtful that anything was going on that was real with that, and also was very concerned about what my colleagues would think. So I said no. Nikki was persistent. So she began to have people call me from around the country and elsewhere saying that they had evidence for their amazing recoveries, and did I want to see the evidence? I said no. Very scientific of me, isn't it? But so eventually, people would just continue to send materials, and I began to realize there is something going on here, and we really should understand this. And so I've had my levels of resistance with this, but then in 2003, I did go down to Brazil. I began to collect medical evidence, and my life has been turned upside down many times as a result, and I've had to rethink everything I've learned, not only in medical school and in psychiatric training, but also even seminary. So it's been quite a journey. And the line, I'll try to describe the line that I'm trying to walk with this as I go through this, because I think many of you in this will look at some of this research and say, well, there's a lot more we could add. We could talk about explicitly about the extracorporeal universe and beings and dimensions and all that. I've chosen not to do that in my book, and I have some really good mentorship and counsel around all of this about how to help us take medicine to the next step, and we're going to talk a little bit about that. So I won't really know how well I've walked the lines until the book comes out this next February and March, but it's my effort. So I'll put you through as my guinea pigs on this a little bit. So what I've done, I've been listening to stories since 2003, and I've had 3 criteria. First of all, the person had to have, for me to look at it, had to be a genuinely incurable illness according to all that we currently understand from the perspective of traditional medicine. And the person had to have medically indisputable evidence for accurate diagnosis and clear evidence for recovery. In other words, biopsies, really clear radiological evidence, unequivocal. And then there couldn't be any complicating factors such as an experimental medication or anything else that the person had taken. And so that's the criteria I set up. And this was not just a professional sort of journey, it was a very personal journey for me. I had a lot of questions that I really needed answers for. That's what drove me into seminary in the first place, and then into medicine and psychiatry. So I really needed to know what was true. So there's a number of things I've concluded. I've concluded that there's nothing spontaneous about spontaneous remission. You know, if you're on the science side of this, you call these events, these healings, you call them spontaneous remissions, and you're taught very clearly in medicine and psychiatry that these are flukes. There's no scientific or medical value in these events. If you're on the spiritual or religious side, you call this spiritual healing or a miracle. But what I believe is that all of these terms, including the word placebo, these are black boxes that we've never really used science to unpack. We're starting to do that with placebo a little bit, but by and large, we haven't really taken these terms and really tried to unpack them with the tools of science and understand what's really going on here. What you see is there's nothing spontaneous about spontaneous remission. These people have changed their lives at every level and experienced really deep changes in perception and belief, and it's just that we never asked what they were doing or what they did. And so from my perspective, you know, we study ultimate performance in health and business. It only makes sense that we study ultimate performers in health. There's a lot of stories buried in the culture around these healings, and people often can't talk about them because their doctors aren't going to believe them. You know, in all these years, I've been studying now 17 years of people with these amazing recoveries, miraculous events, and not one person that I've studied has ever had a doctor say, what happened? What was this really about? The best that they'll do is say, well, whatever you're doing, keep doing it because it's working. But they aren't curious, which is just fascinating, which just shows how powerful the paradigm is that doctors are socialized into, you know, that we can't even let ourselves ask, how did that happen? So it's an uncharted wilderness, which is really a privilege to be able to study. So, yeah, science calls it spontaneous remission, means no, and the word spontaneous means without cause. That's a very unscientific way of understanding it, isn't it? It's just fascinating. I mean, I think in retrospect, science and medicine are going to go, of course we should have been studying this stuff. So what we're going to talk about today, I'm going to use stories to provide ethical grounded hope. I think that as doctors are very trained to not provide false hope, and I think that's important and valuable and important. But ethical grounded hope, rooted in medical evidence, is critical for people to have options and opportunities. And to think when people tell their stories of recovery, what's fascinating is a person will listen to this inspiring story, and they'll say, well, if that person can do that, then this is a possibility for me. And so you want to provide grounded hope, rooted in medical evidence. You want it to be ethical hope, but we all need hope. So we're going to talk about stories, and I'm going to talk today because I think pictures are really powerful. So I'm not going to just talk about incurable illnesses. I'm going to talk about some stories that I have great pictures for. And we'll talk about, and I think illness plays a lot of roles in the psyche and in the soul. And so it's not always about the healing. I don't think the point is always to find a healing. I think the point is to find the path that's unique and right for you or for each one of us. And then we'll talk about how the exciting thing is I think the disease model, as we were talking earlier today, is slowly being supplanted by approaches that are built on what's right, unique, and magnificent about each individual and what helps us create flourishing lives. So I'm very interested not in a science of disease, but what we can do to open a science of health and healing where we actually study how people heal and what a medicine of hope and possibility looks like. Let's see. There we go. I know someone tried to steal my joke earlier, but this is the only treatment plan he has under his current health care plan. I think that's relevant whether you're in the NHS or Canada or the United States or wherever, maybe even Brazil. So first story I'd like to tell, Emily Bowler. We grew up together. I didn't know her very well when I was young, but we've connected now in the recent years. So she's an artist. And she decided in 2008 that she was going to not just be an artist on paper, she was going to be an artist with her life and her body. And she'd been through a lot. Emily had been through a really traumatic childhood. She suffered a lot of abuse. At the point on the left two pictures, these pictures were taken after her son suicided. He had a really difficult story of a combination of bipolar disorder with diabetes, which is like pouring gasoline on fire. And he died in the context of really a tragic story around that confluence between elevated blood sugars, probably a partial delirium at least, and a manic episode. And so as a mother, that's a devastating event, of course. She was, in July of 2008, she was actually in Italy and was at, I think I have the details pretty correct here. She was at the sculpture of Statue of David by Michelangelo, and someone, I guess, had smeared something on it and defaced the sculpture in some way. And it was, as an artist, it was very insulting to her that something so wonderful could be defaced that way. And she all of a sudden was hit with this epiphany. She realized that she had been defacing her own body and mind for her entire life, that she had been putting toxic thoughts and toxic foods into her body her entire life. She decided at that point she was going to change her life dramatically. And she read a book called Eat to Live by Joel Fuhrman. It's an excellent book. At least in the United States, those of us in the healthcare field are given a lot of misinformation about what genuine nutrition is, and it's a really confusing area for a lot of us. Understanding of what genuine nutritional density is. And it's not about food groups, it's not about counting calories, it's not about getting certain proportions of different food groups on your plate. It's making sure that the foods you eat, that each of the foods is really nutritionally dense with the kinds of vitamins and minerals and phytochemicals that your body needs. So she read that book in the context of this trip to Italy, and it really changed her life. So in the middle, she took a picture of herself, and she documents all this on her website. The middle picture was taken in July of 2008. The picture on the right was taken 12 months later in July of 2009. And she had struggled with food her entire life, but now she eats what she wants, but she just makes sure that it's nutritionally dense, and her body found the path it needed for a natural path. So she didn't have genuinely incurable illnesses, but I'm telling her story because it's great pictures, and it's the same things that she did that I see over and over again. Her elevated blood sugar, her elevated cholesterol, her high blood pressure, her medicines for anxiety and depression. She was on all of these wide range of medical and psychiatric medications in July of 2008. By the time July 2009 came, Her blood sugar had normalized, her blood pressure had normalized, her cholesterol was normal, the medicines for anxiety and depression were no longer needed. She was off of all of her medical and psychiatric medications. And in the last 10 years, she has just continued to go down this path that has been a very spiritual path. She just wrote a book that came out called Starved to Obesity that came out, I think, about 4 or 5 months ago. And that just continues to show the path for her. And for her, it's been a spiritual path, but she's really emphasized the path of nutrition because that's been an important part for her. Other people, it's a different kind of path, but this is still an important piece of things, I think, at least in the culture where we have a lot of the foods that we are socialized into eating are really not that healthy for us. And I know that she's been an example for me, and has been one of the people that's helped me change the way I eat most of the time. This is a great story. June Stein lives in San Diego, Southern California. It's a story not only about the power of nutrition, but also about the power of getting out of chronic fight or flight and into a parasympathetic healing state. I think a lot of us, we don't realize how much we live with chronic stress that is not good for our bodies, and that fight or flight that we're in too much of the time actually prevents the possibility for healing. She found a path around that I think is really illuminating. So she was a young woman in her 20s, a very successful accountant, and married to Lee. One of the reasons I tell her, this story I actually tell in the book, and the reason I tell her story in the book is you're taught that spontaneous remission is a fluke and that it just happens out of the blue without cause. Well, when you have 2 or 3 stories of spontaneous remission in the same family for radically different diseases kind of pokes another way of poking a hole in that whole assumption. And so there's a lot of stuff that's happened in this family with very different diseases. And I think it's a testament to some things that are just, Lee and June have a wonderful relationship. They have a lovely family. And so she was diagnosed over 30 years ago with an illness called ankylosing spondylitis, which is a devastating, incurable illness for which there is no cure, especially then. And what happens is that you're starting in the pelvis, your bones begin to calcify, and it just creeps up the back of your spine. And so all of us twist and turn and move with our bodily movements all day long, and our spine also twists with all of that. Ankylosing spondylitis is an autoimmune illness that basically turns you into a concrete and movable mass in a lot of ways. You can't move. And your vertebrae, it's called bamboo spine, where your vertebrae, they all just calcify together into a bamboo spine. It's a devastating illness. So this is very difficult for her. She decided that she was going to, what she told her doctor was she accepted the diagnosis but refused to accept the prognosis. So she asked for some exercises. He handed her a sheet of exercises, and she said, "This is for an 80-year-old woman." So she threw that away. She'd been raised in New York in a traditional, very loving family, and had a very traditional relationship with allopathic medicine. They were living in San Francisco at the time, and she decided she would try yoga. So she went to yoga, and she was in a lot of pain at the time. She went on pain medications for a while, and she's glad she did for a while because she said just having that pain come down allowed her to just be able to breathe again, kind of collect herself, and just figure out what was, just to feel differently for a while. But then she began to realize that when she went into yoga, that the pain medications were creating a numbing effect and preventing her from really being able to pay attention to her body. So she went off of the pain medications, and then I think that she must have a tremendous capacity to tolerate pain because she would just push herself into these poses. And the yoga became the beginning of a pathway for her that has been spiritually really important. And there's things with some other beings and things too, but she doesn't talk about that very publicly. So she began to do that very avidly, and has now been disease-free for well over 30 years. And you can see that she doesn't look like an immovable mass of concrete in any stretch of the imagination. And every person, she like every person I've talked to, is so grateful for the illness in retrospect because the illness turns out to have been a gift because it so fundamentally changed their relationship with themselves. And so I think it's important to understand that she'll say that this wasn't really about the yoga, although we can talk about the yoga. It was really this deeper spiritual opening for her where she really ended up having a very different experience of who she is in the world and even having a different experience of the kind of world we live in. And that's a very common sort of thing. So it's an amazing story. I tell this story too because I think it's just important to understand the different roles that illness can play. So Dana Lewis has a really brittle form of diabetes, type 1. And so she was diagnosed in her early teen years and lived for a number of years not sure that she would wake up in the mornings because her sugar was so brittle that the blood sugars would fluctuate wildly in her bloodstream. So what she did was she developed an open source artificial pancreas, which is brilliant. And so what she did was basically she invented an artificial pancreas software program that regulates her blood sugars automatically for her. So now she can sleep safely, she can exercise normally, but she made it open source. So now all these people around the world can take that same software and adapt it to their own needs. I spoke at a do-it-yourself conference in Austin, Texas, and it was just so fascinating to hear this whole do-it-yourself movement, which is gaining ground, where people are just not going to wait for doctors to figure out solutions for them anymore. They're going to figure out their own solutions. And I think that's another piece of this, where people are taking charge of their health, whether it's June or Emily or Dana, and finding a path that really works. And in doing that, that's helpful to others in different ways. And so I just think it's a great story. There was a person I met there who invented his own surgery that saved his life. And he found old reports from 1920, I think it was, that this particular surgery on the adrenal glands had been done on a mouse, and then he began to talk doctors into doing it on bigger and bigger animals, and then he finally talked a doctor into doing the surgery on him. And his mother had died from the adrenal disease that he had, and now he is a motivational speaker, and it's a fascinating story about what it took for him to convince these doctors to do the surgery. So I tell this story because I think this is someone you all know. He's from your own part of the world. Stephen Hawking. He was a very famous physicist, died, I believe, in February approximately of this past year. And he didn't have a recovery from his illness, but he was told at age 21 that his ALS would kill him within 2 years. And clearly it didn't. He lived for another 55 years and died, I think at age 76, if I remember right, approximately. And he attributed his longevity to keeping his mind active, which he did, we know, and to a sense of humor. And I think that vitality, I have my literary agent has done was working on a book with him at the time of his death, and talks about the intensity of his eyes and how, even though he's imprisoned in his body, how alive he was as a human being. And I think that's worth understanding because I'm sure that played a role in his longevity, lasting 53 years longer past expected. So he was his sense of humor. So he was on HBO's John Oliver show one night, and John Oliver, I've not seen the show, but he's a comedian, and they were talking about parallel universes. And so John Oliver said, is there a parallel universe where I'm smarter than you? And Stephen Hawking said, yes, and also one where you're funny. And then John Oliver said, well, is there a parallel universe where my alter ego is dating actress Charlize Theron? And Stephen Hawking said something to the effect that, no, that's beyond the bounds of scientific possibility. But he was an adventurous soul, and I think that's also, that vitality came out in a lot of ways. So I'm associated with Singularity University out in California, where there's really using technology to push the edges into a new paradigm of medicine. We talked earlier that higher levels of consciousness are associated with new technologies that help these new paradigms come forward, and I think that's what's happening now. And so they took, as part of a publicity stunt, they tried to get permission to take Peter Diamandis worked hard to get Stephen Hawking into sub-G space, and it was a lot of drama, and doctors said he was going to die if he did it and all that kind of stuff. Well, he got up there and experienced the weightlessness of his body and was free in some ways from the immobility that characterized his normal life, and just loved it. So they stayed up there. I think they did 9 loops or something like that, and he did not want to come down. And it's a great story because he had to defy medical odds. They had to get so many different malpractice policies to get approval from the FAA and all of that. But just his vitality in pursuing that it's a great story, I think.